Hey Jane, so at your initial visit, you came in with the bilateral leg pain that went down and it was in the plantar aspect of your foot and it was dull at times. That we will talk about later, but now we're going to talk about your shoulder and cervical and thoracic pain. So it looks like that you had this after a fall and it hurts with any flexion and rotations. And with that could cause what we call subluxations in the spine, which you have 24 vertebrae in your spine and they stack up on top of each other. And in between each of those, you have nerves that come out. So if you fall, have trauma, those can get misaligned and not move properly. And that could irritate those nerves. And when you irritate those nerves, you could have pain. You could have the tight muscles, which you do in the back. And then with the leg pain, we want to refer you to behavior specialist because we feel like with the diagnosis that we have at the time, we need to get further testing. We feel like that we need to make sure that physically, mentally, all good health is as we try to go and take this on and see how it goes. But so here I'm going to give you some paperwork, and this describes in detail what we're talking about when we say the subluxation and how it can cause pain and what it can, and how fixing it, like adjusting, can move it back and cause the nerve to function at an optimal level, which would, since the nervous system is a master system of the body because it controls every single thing in every single cell, tissue, everything. So if any sort of nerve is irritated, that's going to cause dysfunction of that specific cell or tissue. And so what we want to do, we want to treat you, and we want to do 1 time per week for a month. And with this, we're going to use what's called an activator. It's almost like it's just a little device and it pushes a button and it has just a little contact right here and it applies force directly to that, and it's used for older people at times, and we feel like that would be the best way to do care because the situation we are in. And so at that time, we want to do that. And then we're going to use what's called Graston. And Graston is where we break up hypertonicity, like adhesions and or increased blood flow in your hypertonic muscles. And those are your things like your upper traps in your back, which those are tight, causing pain from the irritation. And then levator scabs. And then from your bilateral leg pain, we can do your soleus, gastroc, your plantar aspect, or your plantar fascia, we can do that, decrease the pain, decrease the hypertonicity, hopefully decrease some overall pain in your legs. That would be nice. And then along with that, we're going to do what's range of motion exercises against a resistance band. So this band will have resistance and I will pull against it, and I will have you go away from where I'm holding it and do the exercise against that constant resistance, which will build up strength in those muscles. And there are times you could have alternate forms of care. There could be times if you want to go to a neurologist and figure out if what we have as diagnosis is 100%, you could go there. If you could also go to a PCP if you're back pain, you could go in that route and you could get medications for your pain if you don't want to do chiropractic. You could also go to a physical therapist or a massage and help that break all that scar tissue, all that tight muscle, get all that broken up. You could do that. And with chiropractic, there is a slight chance after that you could be a little sore. This could just be us pushing down, pressing, moving, and everything. With this, you could ice for 10 minutes and then rest or take it off for 30 minutes. And then with cervical adjusting, there is a slight risk of a stroke, but in in cases where people do, they usually have pre-existing conditions, like it was oncoming, like it was coming on, like. But with activator, that will decrease the chances of something like that happening. And overall, we just want to decrease the amount of pain you're in. We want to decrease the amount of the hypertonicity of your traps, your soleus, your gastrocs. We want to do all that to make you feel better. We want to fix the subluxations in your back, which these will improve your overall nervous system function, which improves overall health of the body, which will do what we want, or which will do the best that we can. And then we're going to also, or at the physical exam, we also had x-rays, and there was a slight arthrosis in your SI joints, which those are your joints right here on your back. And then also what's called degenerative joint disease, or arthritis, or osteoarthritis. You had it in your cervical, thoracic, and lumbar spine. We will keep an eye on this. You also had some hilar lymph node calcifications and some anterior listhesis. We'll try to do everything we can to fix these. And we're glad that you're coming in here and getting taken care of. We will do everything we can to make it the best that we can. And if you have any questions, don't hesitate to ask. We will answer it. And with that, if you would like treatment, I would have you sign an informed consent, which tells you that we told you what we were going to do, what our plan of care is, and how we're going to act on your injury, and how we're going to decrease your pain and everything, and how it gives you the risks, the alternative cares like the PTs, the doctors, if you want to do that, the benefits of doing it. So that says all that. So if you would, it was nice to meet you, and I hope you have a good day, and hopefully we can get you taken care of. Thank you. Bye.